pajamas?
Recording has started.
Something like that.
You said yes?
Something like that, yeah.
Okay. So, hi, good evening, everyone. It's Therapy Thursday. Yeah, yo, 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 yo. It's Dr. Delvina. I'm on with Dr. Ivan Lopez. You guys can't see him. There's something that's happening with Facebook where I was actually going live with him on Facebook and was going to pull him on the camera, but that's no longer an option. So I'm actually on Blue Jeans, which, by the way, if you ever want to meet with me, patient doctor type of thing, if you want an appointment, we can do a Blue Jeans assessment. I will post my meeting ID in the link. But right now I'm on with Dr. Ivan Lopez. I'm discussing dementia tonight. And the reason why I'm discussing dementia is because with COVID-19, with the stay-at-home orders and the social distancing, folks are struggling a little bit who are caregivers and caretakers and people who have dementia. And I'll give you some examples as to why these people are struggling and having difficulties with these new orders. And also some people have asked me previously about dementia. Dr. Ivan Lopez, do not play with the camera. So you just went off the camera. So introducing Dr. Ivan Lopez. Dr. Lopez is a neurologist. He's an assistant professor. A professor of neurology at Marshall University. You can't see him, but you'll see him later once I do post this video because I'm recording our Blue Jeans session. So you can't see him now. You can see me. You can hear him. I want you guys to hear about dementia or memory problems, okay? So Dr. Lopez is a professor of neurology at Marshall University, and he's also a full bird colonel in the Army Reserves. He has a long history, professional expertise. He has a 24-page CV curriculum vitae, and so I just want to hit up some of the highlights. So Dr. Lopez has been in the Army since June 2005. We were talking about this earlier. I was trying to remember where we met originally. Was it in Iraq, Dr. Lopez?
It was not. It was, we met in Atlanta, probably in 2006. I would imagine 2007, 2006.
Okay. Oh, yeah. So you said at APMC when we went for our training.
Right, we were there, and then in the evening we went to have dinner. You and I, and yes, actually we did. But you and I, and there was someone else. So the three of us went to have dinner at a nearby restaurant, and then that's when we met. I remember that very distinctly.
I do remember having dinner now because we were staying at that hotel. With the Army always sends us to that same
Yes,
hotel.
yes.
Starts with a D. The something Inn, Drew Inn, Drew.
Drury.
Yes, that one. Yes, I remember that now. Okay.
Okay.
And then I saw you in Iraq, in Baghdad.
Yes, we met again on the flight back from the Middle East. I cannot remember when, 2010. So a couple of years after 3 or 4 years maybe after we met originally, and then you were coming from no, we met on the way to the Middle East and also on the way back.
So that was when I went to Afghanistan. So that was
Yes.
2010, you said. Okay.
Yes, you went to Afghanistan, I stayed in Iraq, and then we met on the way back.
Gotcha.
Yes.
Well, so I know I had dinner with you, so I know you're an awesome person, or I would have never had dinner. And I also know that I also know that you're well qualified to be the expert tonight on dementia and answer some questions for my viewers and the folks who might join later or watch later. People struggle with understanding dementia, aka old timers. You remember what I said to you the other day about that term, old timers, right?
Yes.
Does everyone call it old timers, or just you hear just certain patients say it?
Well, many people call it Alzheimer's because one of the types of dementia is Alzheimer's disease, and Alzheimer's and Alzheimer's, they sound about the same from a distance.
Right.
And so
Okay.
people call it Alzheimer's. And of course, Alzheimer's disease, one of the types of dementia, is more common in old people. So I can see why people call it that.
Okay, because Alzheimer's sounds like Alzheimer's,
It sounds
and
like it,
because it happens in usually older people.
usually.
Gotcha. All right. So you have been, let's see, you've done a lot of research also. Um, Before or during a lot of your clinical work, you've been a co-investigator on several papers. It looks like a lot of what you've done has been a lot of stroke, work in strokes, also with headaches and migraines. So is your expertise more so strokes and migraines, or?
Yeah, that is correct. I'm certified just like you by the American Board of Psychiatry and Neurology and Neurology with special qualifications in child neurology, but I also have certifications in vascular neurology, also known as stroke, and I've been certified in headache medicine by the UCNS for several years too. I like to see patients with headaches. I know many people don't like that, but I enjoy it.
Yeah, it's not popular.
No, it's not. And strokes, I like stroke because you have to make a decision very quickly, and I like the adrenaline rush of going to the emergency room and make a decision quickly, and mm, that could change the patient's
Mhm.
outcomes immediately. You have to make a decision. So that adrenaline rush, I think I'm addicted to that. That's what I'm in the army, I guess, in a way.
Okay. Sounds good. I mean, you're not the only adrenaline junkie I know. I get it.
You're right. I'm
So,
sure.
on Instagram, on Facebook, I have you both here to my left. Hello. I'm with Dr. Ivan Lopez. He is on a Blue Jeans meeting with me. We're doing an interview tonight talking about dementia. So we'll jump into it. I just kind of justified why he's my expert tonight. So, Dr. Lopez, I want to get right into the questions. I had some
Yes.
folks send me some questions, caregivers, and also I want to start with an introduction or an overview on dementia. Can you define for us what is dementia in layman's terms?
So dementia is the progressive decline of what we call higher cortical functions, and there are many domains of these cortical functions, and so the definition implies several things. One thing is, of course, the progressive decline. Dementia doesn't happen overnight. When people change overnight, we don't call that dementia. The change has to happen over months, several months. When
Hmm.
you ask people, hey, listen, your loved one, for how long have they been acting like this? They cannot pinpoint, oh, it was on the 10th of April of 2016. They cannot say that. They say it has been a gradual thing. And then they turn to each other and say, listen, when was the last time? You remember when Christmas or the summer when we had a family reunion that we said to each other, hey, listen, grandpa doesn't look fine. He's acting weird. It is like that. It is a gradual decline. You cannot pinpoint the exact time when this happened. And the other thing is that dementia has to involve several domains of cortical functions. And to mention some of those domains, memory is one important one, but that is not the only one. There is judgment, there is reasoning, there is calculation, there is what we call visual spatial orientation, meaning the ability to get around in the streets or get to the grocery store and get around. So there are multiple domains that are affected. Another important part of the definition of dementia is that the deficits must be of such magnitude that interferes with the patient's ability to work in a normal environment. So it has to have that. More than one cortical domain or cognitive domain, gradual onset, and severe enough as to interfere with the individual's ability to perform in society. So that's the definition.
So, if you will, I know you said it's a progressive decline of cortical functioning. What do you mean by cortical?
Because memory, reasoning, judgment, calculations, visual spatial orientation, and certain type of behaviors, we believe that they will come from the cortex of the brain. You may know that the brain has two basic portions: the cortex, which surrounds the brain, and the outer portions, and then the internal parts of the brain. Most neurons are in the cortex of the brain,
Okay, so you
There,
guys hear that, right? Why he called it cortical. He's describing that it's because the neurons are on the exterior or more external part of the brain, and this is
correct.
where that's where the disease occurs that causes this progressive decline. And you guys heard him say that it's in all of these different spheres. I guess you mentioned memory, you mentioned
Judgment, reasoning, calculations, the ability to
function.
subtract and add and multiply,
Okay.
and visual spatial orientation. That's important. Some people with dementia, they get lost at the grocery store. They cannot find their way out of the grocery store. They cannot find their car. They get lost in familiar places.
Okay. So remember, dementia is not just inability to remember things or recall. Dementia can also affect a person's ability to calculate, to find their way home, to get to the grocery store, a place that they may have gone several times. Someone said that their mom and two aunts are dealing with dementia. Can dementia be? I'll sort of segue to that since this person mentioned it. Can dementia be genetic or familial? Does it run in?
Yes, yes. Some types of dementia, Alzheimer's dementia, which is the most common type of neurodegenerative dementia, the most common type. In some cases, a minority of cases, not the majority, but a minority of cases, it comes in your genes. And given the right circumstances, you're going to get it eventually.
Okay.
Fortunately, most cases of dementia are not like that. Most cases are sporadic, they just happen.
Okay. So most cases of dementia are sporadic, they just happen. A minority of cases might be genetic. So if
Correct.
someone in the family has it, then someone else may also develop dementia. What causes dementia?
So there are different types of dementia. We have Alzheimer's disease, which is produced, we think now, by a misfolding of certain proteins in the brain. So proteins, they have a three-dimensional structure, and when that structure is disturbed, that protein accumulates in certain parts of the brain cells, and we believe that's part of the process that leads to dementia. But there are other types. That's Alzheimer's disease, the most common type. But
Okay.
there are other types. There is a type of dementia that we call dementia with Lewy body. These patients, they don't have so much memory problems, but behavioral problems.
Hmm.
And there is also another protein that is misfolded, and when the protein misfolds, we call that Lewy body, Lewy, Lewy bodies. There are
Hmm.
dementias produced by strokes. It's not uncommon to have patients who have multiple strokes over the many years, and then they can have that. There are dementias that are produced by deficiency of vitamin B12 or thyroid disease, kidney disease, and so forth. Those dementias, of course, are easy to, so to speak, to treat
Hmm.
because if the patient has vitamin B12 deficiency, you supplement them with that, and then they get better.
Hmm.
So there are different types.
Okay. So, someone asked, what's the difference between dementia and vascular dementia? So, I think, Mr. Gay, what Dr. Lopez is saying is that there's different reasons or different causes of dementia. And so, dementia is all of the things that he mentioned, not being able to calculate, getting lost, not remembering things. Um, your question about dementia in general. So dementia covers all of these different types, right, Dr. Lopez, that you mentioned, the Alzheimer's dementia, the vascular dementia, the Lewy body dementia. So the vascular dementia, Dr. Lopez, is caused by hypertension, high blood pressure, elevated blood sugar, or diabetes. So insults to the vascular system, the vessels. Am I correct in saying that?
You're absolutely correct.
And you can
Yes.
say no. You can say no. Listen.
I would say no, but I cannot say it because you're right.
Okay.
Okay.
So, Mr. Gay, I think that's the answer to your question. What's the difference in vascular dementia? The problems with the cortex, which Dr. Lopez just explained in detail for us, the problem comes from damage to the vasculature in the brain, caused by different things, whether it's high blood pressure or elevated sugar. Okay. So are there some warning signs of dementia? Like if people are saying, oh, my mother is 75, what should I look for? I had a friend whose mom developed dementia. What do I look for as far as warning signs go?
There are not really warning signs. I don't believe that we can say there are warning signs when people become forgetful to the point that they cannot function normally, or when their judgment is off, or when they cannot calculate, like they cannot keep their checkbook balanced, or when they get lost, or when their judgment and reasoning and their behavior is off. That's dementia already. There is no warning signs. Once you see that, then you see. But remember, you have to have at least two different domains affected. So it
Gotcha.
could be
So,
memory and behavior. It could be calculations and visual spatial orientation. They have to be at least two. And
so
once you have that, then you
on
have it.
social, guys who are listening on social media, he's saying two domains have to be affected for the diagnosis of dementia. And those domains are what we were describing a little earlier in this interview. And so warning signs don't really exist because once someone gets to the stages of manifesting or showing behaviors that they have the disease, then there's really no turning back.
Some people say that there is this condition that we call mild cognitive impairment. When people have some issues with memory, usually it's memory.
Hmm.
And then some patients, we used to say a few years ago that some patients will evolve into dementia eventually, and some patients will revert back to normal, um, depending on circumstances. But more recently, some people have doubted that this even exists, this mild cognitive impairment. Uh, but so many people have memory issues on occasion. We all forget things, but that's
Right.
not dementia, right? I forget my keys all the time. I forget my phones. I forget things all the time, and that's not dementia though, because number one, I look for the things and I find them. Number one,
Hmm.
and usually those type of forgetfulness means you're distracted or inattentive. You have so many things going on in your life, so many stressful factors. You're just busy with doing 1 million things. I forget where I left my keys, or I forget where I left my ID. The other day, I left my ID at home. I went to work and I had to come back and get my ID. That's not dementia. That's
That's
just
not dementia. You
inattentiveness.
guys happy? So if you forget things, you don't have dementia. If you have a mother or father or grandparent who's 60, 75, 80, and they're forgetting things, it doesn't mean they have dementia. Because what Dr. Lopez just described is that you have to have abnormalities and more than just forgetfulness or memory problems. There have to be other changes as well for a diagnosis of dementia. Um, Someone said, so I'll get to your question, Rock 19. So we've already gone over how to distinguish the types. You did that very well. You described the different types and some of the causes of those. Now, who should take medication for their dementia? That's a common question is, well, my mom is 75. She was diagnosed with dementia. Does she need to take medication specifically for dementia?
We since the early 90s, we have had medications that we call uh, anticholinesterase inhibitor medications, and we have three on the market. And more recently, maybe 15 years ago, there was another medication that came to the market that works in a different way. But these medications, honestly, they're not great.
Hmm.
They slow down the progression of the disease, but only mostly memory and behavior. They don't help in other domains, and they just slow down the progression of the disease. They slow down the decline of the individual, but they don't help with the underlying mechanism of the disease, with this, which we think is the misfolding of these proteins inside the brain. So they don't help with that, and uh, and they come with side effects. These
And that was
medications can,
that was my next comment too, is that they
yeah,
could possibly cause side effects.
yeah, diarrhea, vomiting, stomach upset. Some people cannot even tolerate these medications. So they're not free of side effects, and they're less than mediocre, honestly. So I guess this is the only thing we have right now. And if you want to slow down the progression of the disease, you can do that. uh, but they come with a price, right? Because patients may have side effects.
Right. Okay. So, if someone is in a facility like a nursing home or a skilled nursing facility, do you think medication, let's say if we're picking and choosing between someone who lives at home and has kind of caregivers at home versus they're in a facility, is there a difference for you in choosing whether or not they should have a medication? I know I've heard neurologists say that, oh, they're in they're contained in a facility or they're being monitored closely, so they don't have to have medication. But if they live at home, then they're more likely to prescribe them medicine.
I would tend to agree with that. Most people come to nursing homes or facilities specialized in treating patients with dementia, not because of
Mhm.
the memory, but not because of the judgment or calculations, but because of their behavior.
That's a
So,
good point.
right. So many of these patients, they have behavioral problems eventually. At the beginning, they just have maybe memory or calculation or visual spatial orientation. They get lost going
Hmm.
home from the supermarket and stuff like that. But eventually, they have memory problems. They become aggressive, paranoid. They can go out in the middle of the night to the neighbors and knock at the door. They can walk into traffic into the highway in the middle of the night, and
Hmm.
that's what produces this. What that's what makes these people eventually be admitted into nursing homes. Not so
Right.
much the memory, but the behavior. So yeah, if they're at home, I would recommend that patients take something for their behavior so they're not at risk. Can you imagine somebody comes into my house? Let's say that I didn't lock the door of my house. Let's say that I didn't. If I
Hmm.
hear noise and I see someone in my living room, who
Hmm.
knows what will happen. So these people need to be, in my opinion, if there is behavioral issues, they need to be medicated.
Gotcha. Yeah, so folks who are just joining Instagram or Facebook, I'm talking with Dr. Ivan Lopez, who's a professor of neurology at Marshall University, also a colonel in the Army, and so he specializes in the brain. And you guys do some psych stuff, some mental health also, but what you do is more interventional and more clinical and hands-on than what psychiatrists do with regard to uh, the brain and treatment.
Yeah.
So. And so we were having a discussion. We are having a discussion about dementia. You guys may have missed already the introduction, but this is being recorded, and I will. Someone asked me if it'll be on YouTube. It will be. And so I'm glad that you mentioned behaviors because most of the time when patients come to the psychiatrist or they come to my office, they have dementia. They're coming because of the behaviors. And also the nursing homes that we go and we cover and treat patients there, a lot of the problems are due to behaviors, the agitation. Also, the not sleeping. Some of them have a lot of anxiety also. I didn't mention this in the beginning, but and there were three main reasons why I wanted to discuss dementia during COVID-19. One of them is we received a call this week from a nursing facility because a lot of the patients were agitated and angry and upset that they can't go outside anymore because of the stay-at-home order, and also not understanding the need for social distancing. So we went and saw several patients, and some of them did have to receive prescriptions for agitation because some were hitting other patients, things like that, and all of them have the diagnoses, including dementia. So that was one reason. The second reason, one of my office patients, her husband is diagnosed with Alzheimer's dementia, and every morning he wakes up, he forgets that there's a pandemic. He forgets that COVID-19, he forgets that he has to stay inside the home. He forgets that when they do go out for certain things that he has to wear a mask and some of these other things. So my patient told me every morning she has to remind him that they can't go outside or they can't do some of their usual things. And I thought, wow, I guess that is a special consideration. You wake up every day, you can't remember what's going on in the world. And then the
Like that
third thing,
movie, right? 50 First Dates.
yeah, right, yes,
Yeah.
yeah, I like that movie, 50 First Dates. And then the third thing is a caregiver, his mother has Alzheimer's, and he just mentioned some special concerns with sort of trying to keep her at home and keep her safe during COVID-19. So we kind of went over the introduction and defined dementia. So let's talk about. There's a couple of questions from social media that I want to ask before we go into the other questions. Someone asked, "What age do you see dementia?"
Dementia usually happens after the age of 60, 65. Uh, well, the most common type, Alzheimer's disease, the sporadic form, usually happens in people 60 and above, 65, something like that. But there is the genetic form of Alzheimer's disease that can appear as in young individuals in their 30s, even younger sometimes, in their 30s, 40s.
Yeah.
But again, this is very uncommon. This is not common. The most common type of Alzheimer's disease is sporadic and would appear in the elderly. And there is some statistics that show that the older you get, the more likely you will get dementia. So, but for every 5 years, there is a certain percentage points of higher prevalence of dementia. So people say that if you get to live to your 90s or 100s, then the majority of individuals at that age will show in their brains the microscopic changes associated with dementia.
Mm-hmm. Okay.
So it's a disease of the old people. That's why people call it old timers, right? Because it's a
Right.
disease of the old people, yes.
Okay. All right. Perfect. Um, would you say, I think this is a good segue to ask this question. Would you say there are things people can do to reduce the risk of developing dementia?
Yes, actually, yes. There has been multiple publications over the last few years showing that many of the same risk factors that are associated with strokes, then the same risk factors, if you control them, if you take action and try to modify them, then you decrease your chances of having dementia when you get old. And I'm talking about the same things that we were talking about earlier: high blood pressure, diabetes, cigarette smoking, uh, increased cholesterol, lack of exercise, stuff like that. And also, it seems like individuals who engage their mind into into cognitively challenging occupations, reading, doing puzzles, crossword puzzle, that type of things. Apparently, there is a little less risk of developing dementia eventually, but this last part is not so clear. But there is no doubt that if you have a healthy diet, if you don't smoke, you control your blood pressure, diabetes, and so forth, you have fewer chances of developing dementia when you get old.
Okay.
So you can
And
do
then,
that.
so exercise regularly, control your blood pressure, try not to develop diabetes or elevated blood sugar. If you do, gain great control over your blood sugar. Engage your brain, do things. He said cognitive type stuff. So reading, using your brain basically to think and make decisions. Crossword puzzles and word searches also. Yeah, would you agree,
Yes.
Dr. Lopez?
Yes. Again, the evidence in this latter part is not so clear, but there is
Mhm.
no doubt that if you have a healthy diet and if you are a healthy individual in general, you will have fewer chances of having dementia later on.
What about, speaking of healthy diet, what about supplementing that diet with certain things? Do you believe in sweet potatoes and blueberries and red grapes, things like that, helping with blood flow and providing certain factors so
There
that
are no specific foods that will help with blood flow. Nothing in specific. And sometimes you see on TV advertisements about this supplement or this other supplement. There is no real evidence that they work. There is no
so
such a thing.
so what about omega-3, fish oil, and eating fish to reduce your chances of developing
I would
dementia? What do
say,
you think about
generally
that?
speaking, if you have a healthy diet, what people call the Mediterranean diet or the DASH diet, DASH, and your listeners and your viewers can look it up, the DASH diet or the Mediterranean diet. People who have this type of diets, they have fewer chances of developing dementia later on in life when they get old.
So that's the best research or studied or the best I guess, data is for the DASH diet or the Mediterranean diet.
That is correct. There is not any specific food. It's not like if I eat onions, I'm not going to have them. It's not like that. You're going
Okay.
to cry a lot and have bad breath, but that's about it.
Okay. All right. Yeah, this will be on YouTube for those asking. It will be loaded on YouTube. So, okay, so let's get into sort of the more kind of, I guess, challenging questions. How do you reset a conversation if a patient gets upset? A demented patient.
It is my opinion that it doesn't make any sense to get into an argument with a patient who has dementia. You just say yes, shake your nod and smile, and try to redirect the conversation to where the patient is not upset. It's not the patient's fault if they cannot remember, if they have poor judgment, or
Right.
if they have a difficulty understanding even simple concept. It's not their fault. They're not doing this to bother anyone. They just cannot help it. So it doesn't make any sense to argue with them. Just try to redirect the conversation to something easier. And I'm gonna tell you something. In a way, it is a good thing because if they're upset about something, a few minutes later they may not remember anymore. So they don't hold grudges. So in a way, I guess it will make things easier in a way.
So you're saying if they get upset, just do your best to ignore them. Hopefully they're getting upset, guys, and they're not hitting you or being physically combative. They're just discontent, or they might curse, or they might say something mean, but just ignore them is what you're saying, because it's not
You know,
going to.
correct. Many daughters, particularly daughters of people who have dementia, they tell me my mom has been mean to me lately. She says mean things to me, and I tell them they don't know what they're saying. They're like kids in a way, like toddlers. That
Hmm.
a toddler may say, "I hate you," and they don't know what hates means. They don't know
Right.
what love means. They don't know the meaning, and they may say things. And we
Right.
all, on occasion, say things just because we're angry. But these patients with dementia, they may have behavioral problems and they become mean. But it is not personal. They're not really angry at their daughters. They don't hate them or anything like that. It's just they just don't know how to behave. They're like kids in a way.
Yeah, they lose the ability to filter. They lose the ability to restrain themselves. They lose the ability, and they just say things. They may do things, but it's because, like Dr. Lopez is saying, they can't help it. So if they get upset, someone is saying redirect. Yes, redirect them. Don't get upset also. If they get upset, if they become angry, the best thing you can do is just love them, not get upset also. So I guess that answers the next question about should you correct a patient if they cannot remember the facts? I say no.
I agree with you. I remember this individual who had lost her husband a few years back, and she became demented. She had Alzheimer's disease, and every morning or every so often she would ask her daughter, "Hey, listen, where is your father?" And then the daughter made the mistake of saying, "Oh, mom, remember dad died 10 years ago," and she would cry. "Oh my God, what happened?" And she would cry, but every time she would cry again and again until somebody said, "Listen, don't tell her that. Tell her that he's at work." "Oh,
Yeah.
okay, so maybe we should fix dinner for him and then she will be happy," instead of reminding her every so
Uh,
often that's that was cruel.
yeah. Oh my gosh, I love that example you just gave. I hope you all can hear him or you'll come back on and watch. He just gave an example. I asked him, should you correct a patient if they don't remember the facts? And the answer is no. He and I both agree, no, you don't correct them. And that's so sad that, so you were just giving an example that this lady would ask, where's her husband? And the daughter would tell him, remember, he died. And she would cry all over again. That's just awful. So the
Day after
answer,
day.
yeah, day after day. So the answer is no, you don't correct them if they don't remember the facts. Because why? They're not going to retain that information. Why would you go through that struggle every day trying to correct them on something they don't remember? If they don't remember that, they won't remember the corrective action either, right?
Absolutely.
How do you manage a false story? Oh, I'm sorry. Go ahead, Dr.
No,
Lopez.
I was going to say, you're absolutely right. Why make them suffer and why go into this struggle? Just go with the flow and make them happy.
Go with the flow. I love it. Go with the flow.
and make them happy.
Oh, someone said my demented grandma used to cry for her mom. We would tell her she went to the market. I love it.
Yeah, exactly. That's exactly what you do.
How do you manage a false story?
What do you mean by a full story?
So I suppose the demented patient is telling a false story.
Okay,
My
so we call that confabulation, right? When they don't know the facts, then they start filling in the blanks and the gaps with false stories. Well, again, you go along with them, and provided that the story is not disturbing for anyone, particularly for them, if it is this confabulation doesn't involve harm or fear or anxiety, then just go along with them and say yes. For instance, let me say, you must be my granddaughter. Maybe it is their niece, but they say, you're my granddaughter. And say, yeah, I'm your granddaughter. Remember? And we did this and that. And you, like if you're playing with a little kid, you just go along and try to make their lives just easy because they cannot remember. So that's what I would do.
So go along with the false story, guys. It doesn't hurt. They won't remember anyway. All right. How do you manage anxiety and fear of a dementia patient? I would say you call me, Dr. Thomas, the psychiatrist, so we can help you
I would
manage.
agree. I would agree with you. It doesn't, when somebody's anxious and they're fearful and they become sometimes paranoid, it doesn't help much if you try to reason with them. Because one of the issues with patients with dementia is that they lose their ability to reason. And sometimes uh, maybe they need to be on medication to relieve their anxiety a little bit. You would try to remove any source of anxiety near them. If they don't like a picture on the wall, well, remove it. If they want to watch such a TV show, well, let them watch it. Try to make them their lives easier. But if it becomes to the point that they're really suffering, maybe then they need to be on some medications.
Gotcha. So again, you're saying go with the flow, make them happy within reason.
Correct.
Okay. So how to manage a family member or patient hearing noises and developing false stories about the noises. So I guess they hear something and then they create a story to provide a reason or an excuse for these noises.
I believe that if the story that they're creating is not harmful, is not scary, then let them believe that. But if the story is to the point that it is bringing anxiety to that patient, let's say they believe somebody's trying to break into the house or somebody's stealing their property, or they see things and they see people in the house wreaking havoc, then maybe they need to be on medications. So if the stories are harmless, then let them do it. But if they become scary and anxiety provoking, um, maybe they need to be on medications. And the best people to do that would be somebody like you, Dr. Thomas, someone who has expertise in this type of things.
Roger.
I can do it, but I wouldn't recommend it. I would go to an expert, and you're the expert.
Gotcha. All right. So we have another question. Let's see. The person asked if the symptoms, I suppose they're saying that these symptoms of anxiety, not remembering, getting agitated or upset, if the symptoms are worse in the evening, usually for these patients.
Yes, they're worse in the evenings. One thing that the family members can do is to try to stimulate the individual during the day. Open the windows, open the curtains, let him walk, let him do things. Turn the TV on, the radio on, I don't know. Once
Got it.
afternoon comes and evening, you should follow a routine. Turn the TV off, turn the lights off, close the curtains and the blinds, and put him in bed and try to remove stimulation. Another thing that people can do is place pictures of their loved ones nearby and
Mm-hmm.
try not to manipulate their environment so much so that there is a sense of routine. Because patients who have dementia, they don't take change very well.
Okay.
they become really agitated when things are not in the right place. And
Gotcha.
so people should try to have a routine. But very importantly is also to make sure that when it's nighttime, there is not much stimulation. Lights are off,
Hmm.
blinds are down, and TV is off, and so forth.
Okay. Okay. So I hope you guys heard that. That was a great explanation of using your environment to try to control what happens with our family members who might be demented, how to help them function better during the day, how to help them in the evenings with relaxing, so that way they can fall asleep and hopefully understand that it is time for rest and relaxation and not be stimulated at night. So if you guys are just coming on Facebook or Instagram, I'm with Dr. Lopez. We've been talking since 8 p.m., 2000 hours for the non-slugs. And we're talking about dementia. We've already sort of broken it down. We've defined it. We talked about whether or not there were warning signs, what some of the risk factors are, the types of dementia. We had some questions regarding what you'll see when someone can't remember things and their behaviors change or they get upset because of certain things. So if you missed it, of course, you can watch again here in the story on Facebook and on Instagram, as well as Dr. Ivan is in front of me. You can't see him. We're on Blue Jeans together, so this is being recorded and it'll be posted in on my YouTube channel. So if you're not already following the channel, it's Dr. Delvina Thomas. So please follow. There's a link in my story on Instagram as well for the channel, and also in my bio on Instagram and on Facebook. So I think we covered a lot of things. Someone asked about vitamins. What are some good vitamins for dementia? I suppose he's asking if when someone has dementia, what type of vitamins they should take. And so I think I know what your answer will be, but I'll let you answer.
Okay, so there is not such a thing as vitamins are good for dementia. That doesn't happen. It's not like that. Uh, Most people in the United States don't need to take vitamins. I think our diets, if you eat fruits and vegetables and you have some dark dairy products, if you have yogurt, cheese, you have all the vitamins you need. There are a few people that are vitamin deficient in the United States. That doesn't happen normally in the United States. So I don't want people to think that if you take certain vitamins, then dementia will get better, or you can fend off dementia by taking certain type of vitamins. Don't fall for that. Those are marketing strategies, people who want just to sell their products. But there is no scientific basis to think that if you eat certain particular food, certain vegetables or certain supplements, you're going to fend off dementia or get better if you have it. As I mentioned earlier, just a good diet that has lots of fruits and vegetables and grains and cereals is good overall, not just for dementia prevention, but for everything. You're healthier in general if you have a good diet and exercise regularly.
I think that's the outro. I think you just wrapped everything up with that response, Dr. Lopez. You're a genius.
I'm
I mean, I don't want to add
not.
anything else. I think that really answers that question, and it also just sums it up for people as far as their diet and these supplements. And so I like that.
Yes, thank you. But I'm not a genius. I can tell you that for sure.
I beg to differ. Colonel Lopez, is there anything else, sir, that you would like to add to this dialogue?
Yes, I want to thank you for what you do. I know that you are very active in the realm of mental health. I uh, I had told you this before today, but you do a lot, and I really, really appreciate what you have done for a number of people in the military service. And I know that your job is very valuable, and I really appreciate what you do. I have I have asked you a couple of times advice about things that I have faced while deployed or talking to younger soldiers that are going through times of stress. And I can thank you enough for your advice, and I overall appreciate everything that you do for everyone. And I appreciate the opportunity to reach your audience. I'm glad that I was able to. talk to your audience because there are so many so much misinformation going around on dementia. Particularly, I am upset that people want to sell supplements unproven just to make a buck and take advantage of other people. That's unconscionable. So I'm glad
Wow.
that I had the opportunity to clear that out.
Okay. Thank you. Thank you for that. And we may have to do a part two on dementia. And also, I think we should talk about headaches and migraines at some point too.
Happy to do it. Fist bump.
Roger. Thank you. Okay, there it is. Thank you so much.
Have a good night.
You too. All right. Oh, wait, before we go, you have
Oh,
to say brain love.
brain love.
Okay, on three, we'll say it together. One, two, three. Brain
Brain
love.
love.
All right. Have a good night, Colonel
Bye bye.
Lopez.